Hormone Replacement Therapy, HRT, can play a significant role in alleviating the cognitive symptoms, often referred to as brain fog, that many women experience during menopause. Brain fog, characterized by difficulties with concentration, memory lapses, and mental fatigue, is commonly linked to the decline of estrogen and progesterone during this transitional phase. HRT offers a way to replenish these hormones, potentially restoring cognitive function and mental clarity. During menopause, the production of estrogen and progesterone dramatically declines. These hormones are not only critical for regulating the reproductive system but also have a significant impact on brain function. Estrogen supports the production of neurotransmitters like serotonin and acetylcholine, which are essential for memory, learning, and mood regulation. It also improves cerebral blood flow and promotes the growth of neurons. As estrogen levels drop during menopause, the brain may function less efficiently, leading to cognitive symptoms such as brain fog. Research suggests that estrogen has a neuroprotective effect, reducing oxidative stress and supporting synaptic plasticity, which is essential for learning and memory. Progesterone has a calming effect on the nervous system, contributing to better sleep and reducing anxiety. A drop in progesterone levels can lead to sleep disturbances and increased stress, both of which can exacerbate mental fatigue and cognitive dysfunction. By supplementing estrogen and sometimes progesterone through HRT, delivered via pills, patches, creams, or gels, these cognitive impairments can be reduced. HRT helps restore the balance needed for optimal brain function. Scientific studies and clinical evidence suggest that HRT can be effective in reducing cognitive symptoms associated with menopause. Here are some specific benefits of HRT for brain fog. HRT, by restoring estrogen levels, may improve brain communication and blood flow, making it easier for women to focus on tasks and reduce distractions. A study in neurology indicated that women who began HRT around the time of menopause showed improved cognitive performance, particularly in tasks requiring attention. Estrogen plays a key role in the function of neurotransmitters involved in memory, particularly acetylcholine. Studies have shown that HRT can positively affect verbal memory and learning tasks. A 2021 review of the effects of HRT on cognition suggested that estrogen may help maintain hippocampal function, the area of the brain critical for memory formation. Brain fog often comes with a sense of mental exhaustion, a feeling that the brain is sluggish or clouded. By making the brain's processes more efficient, HRT can alleviate this fatigue and improve overall mental energy. Estrogen supplementation has been linked to improved synaptic plasticity, meaning that neurons in the brain communicate more effectively. Restoring progesterone levels through HRT can help regulate sleep patterns, which are often disrupted during menopause. Improved sleep quality is essential for cognitive restoration, as sleep plays a crucial role in memory consolidation and brain repair. Additionally, HRT's regulation of both progesterone and estrogen can reduce anxiety and stress, leading to clearer thinking and improved mental performance. While HRT can provide relief from cognitive symptoms, its long-term use comes with both benefits and risks. Hormone replacement therapy, HRT, offers a scientifically supported treatment for brain fog during menopause by addressing the decline in estrogen and progesterone that underlies many cognitive symptoms. By replenishing these hormones, HRT can improve brain function, helping women regain mental clarity and cognitive sharpness. While it is not a one-size-fits-all solution, HRT can be a valuable option for those struggling with cognitive issues during menopause. It's important to weigh the benefits and risks carefully and consult with a healthcare provider to determine if HRT is the right choice, particularly considering the timing of initiation and individual health history.